Life lessons from the deathbed. There's some things that I've heard in the last day and a half or so that I want to kind of remind us about. One is this whole thing about that dichotomy between that work-life balance language. You know, how sometimes we hear this whole thing about, you know, there's that work that you do and then there's life. As if somehow work and life are antithetical, as if they're opposites. But where many of us come from a tradition in which some concept of vocation or calling tends to operate, and there's that notion that somehow work is part of life, not distinct from, but part of. And I think it's important that we kind of reflect on that just for a moment, because regardless of what your work is, part of what motivates you to do that work, I'm assuming at least, is your spirituality. It's your beliefs about what matters in life that help to shape and drive your actions, especially your actions that sort of so occupy, you know, a third of your life on average, at least Monday to Friday for most of us. And so there's something about that it's good to reflect from time to time whether or not that spirituality, our personal sense of what makes life meaningful, whether that is being engaged in our work or not. Another thing I've heard is that whole aspect that since spirituality is core to who we are as human beings, we can't interact with one another without spirituality somehow being part and parcel of that interaction. So we can't deal with one another as if spirituality is an add-on to what we do. It's just inherent, because we can't be human apart, in part, from having a spirituality. Now, there's some things that I also believe. One of the things is I believe that what we need is to hear the spirituality implicit, sorry, mistake. What we need is to hear the spirituality implicit in what others are saying, more than we need to know how to begin a conversation that introduces spirituality to the conversation. So what I mean by that is that in my work, I find the vast majority of the time, I don't even need to introduce the subject of spirituality, because as a human being interacting with another human being, when spirituality is present, if I've got the ears to hear, the patient, the family, the staff member, the custodial staff, whomever, we're already having a conversation which is in part spiritual. And my job most often is to hear that and maybe be selective about reinforcing that, or playing it back a little bit, or reframing it, or restating it, or maybe just kind of exploring it. So one of the questions the other day about sort of in response was, you know, how do we begin these conversations? And I guess what I believe is the conversations are there for the having, if we just listen with spiritual ears. Another thing I believe is that the best way to learn to do something is to start doing it. I'm a CPE teaching supervisor. I teach people how to do spiritual care, how to learn how to do this thing. And part of this sort of philosophy of education that I'm part of suggests that you take people and you have them go and visit people and start engaging in spiritual conversations with people. Because in the actual doing of that, people are going to learn for themselves what the gaps are in terms of what they need to learn. And that's where the whole thing of, if we take the stance, first and foremost, of being learners, and recognize that our patients, family, staff, whomever, are our teachers. That introduces a whole different ethic and dynamic to the relationship. But one that seems in some ways counter to kind of the prevailing philosophy of healthcare in the first place. Because healthcare often is kind of predicated on a notion that someone who is sick and in need of something comes seeking the wisdom of the experts. And there's kind of this inherent, they need, we have, and, from the generosity of ourselves, we give to those in need. Whereas this dynamic changes that, flips it 180 degrees. It says that we're the ones who are in need of what others have to share. So I stand here as someone who teaches people how to do this, but I also stand here as someone who doesn't have any kind of advanced graduate degree. I mean, I have the sort of normal degree for people who go into ministry, which is a Master of Divinity degree, but I don't have a PhD in anything. I'm not a doctor in anything, because it's a different kind of learning. It's that more experiential, self-directed learning. And sort of the primary textbook is the patients, the living human documents. And it's the interaction and the connection with them where the learning happens. I also happen to agree with Socrates, who said that the unexamined life is not worth living. And one part of the education that I'm involved with is trying to examine life. And there's one part that's often involved in that process of examination that we refer to as theological reflection. And we know from other professions, that reflective practice is one of those sort of big trends that's emerged in the last 10 years or so, where it's almost as if everybody becomes their own individual CQI committee, and they're looking to see how they can improve the practice of their profession. But this is not geared just to the practice of spiritual care. It's also geared to the person. So when you reflect on your own life and your interaction with someone, what is it that they have taught you? What are the lessons that you've learned from them? And so that's what the rest of this time is going to be. It is 3 case studies that look at some things that I have learned that patients have taught me. And I don't want you to think that this is exhaustive. There's still lots of things I need to learn, and there are lots of things I have learned that I'm not going to talk about. But these hopefully will kind of illustrate what I hope will become part of your practice. That you, regardless of what your role is in healthcare, that you will begin to ask yourself, what have I learned from this encounter with this person? And that will become a regular part of your daily routine.